Everyone, welcome to class 2 of Integumentary System Incision and Drainage. So, in Incision and Drainage, we will see first how the procedure is performed. Okay, here there will be abscess with the pus. Okay, it is usually swollen. The physician will make a small cut. Okay, he will make an incision. Then he will drain the pus. Whatever the pus is there, he will drain it. And then he will irrigate the wound area and he will apply the bandage. Okay, sterile bandage for dressing is applied. Next we will go with the CPTs, okay, in the form of a flowchart so that it will be easy to remember and know the concept easy. So 10040 is for your diagnosis will be Comdon cyst or pustules. Here the patient with these skin lesions, okay, Comdon's cyst pustules. So the physician will clean and antiseptic that lesion area. He will make a small incision over the skin. Next, the lesion is removed and the lesion is opened with the instrument. Okay, he will open it with the instrument and the contents are drained. Okay, whatever the contents are there, he will drain it and the fluid or pus is expressed. So either he will do simple incision and drainage and he will he will drain the contents, or he will do marsupialization. Okay, here cyst exteriorized and a pouch is created. Okay, and left for healing, secondary healing. So he will not no sutures required for the whole lesion. Okay, in marsupialization we will see once the picture. Here cyst is there with the fluid. Okay, he will make an incision and he will open with that he will not cover the whole abscess with sutures. He will left it open. Okay, only edges he will suture it and lesion is left open. Okay, here he will not suture whole, he will keep it open, he will only suture the edges. That will create a pouch. Okay, that is known as marsupialization. Okay, then we have 10060 to 61. So your diagnosis will be abscess, carbuncle, furuncle, paronychia and hydradenitis. So patient with abscess or a cyst, he same IND he will do. He will drain the pus contents. Okay, and curative is performed and irrigation is done. Okay, and wound is left open for the continued drainage. So optional is either he will place drain placements or gauze strip packing he will place. Okay, this is optional. So whenever you are coding 10060 to 61, what you need to check? You need to check for the complexity. Whether it is simple or single abscess. If it is a simple or a single abscess, you will code 10060 CPT. So if it is complex or multiple abscess, then you will code 10061. Okay, if abscess are multiple and it is complex, then you will code 10061. So in 10061, healing by secondary intention or delayed closure if needed. Okay, so healing by secondary intention or delayed closure. Okay, that is the thing you need to remember. Then we have CPTs 10080 to 81. Your diagnosis will be pilonidal cyst. Okay, in 1008081, so the diagnosis will be pilonidal cyst. So patient with a pain or swelling near the sacrococcygeal region. So he will make an incision over the cyst pocket and the cyst is open with the instrument, surgical instrument, and the contents are drained. Hair, debris, whatever fluid is there, he will just drain it and wound management is done. So how will you distinguish whether it is pilonidal cyst excision is simple or complicated? So in simple IND of the pilonidal cyst, he will left it open. and packed for healing. Okay, he will left it, he will do simple IND and he will left it open and packed for healing. That is 10080. Okay, that is a thing. Whereas in whereas in 10081 here marsupialization. Okay, more complicated word you need to check. Okay, more complicated. So in some more in a complex you have to check for the more complicated word. Okay, so here marsupialization, already we discussed marsupialization, right? That word, or edge approximation. Okay, primary closure, the or primary closure, then in that case you will code 10081 for post procedure care and the healing is completed. Okay, next we have 10120 to 10121. Here in this patient with the foreign body embedded in the subcutaneous tissue, so you need to confirm the location and the depth. Okay, so how you will confirm? With the help of imaging if needed. Okay, then skin is prepped and a small incision is made. Foreign body identified. Foreign body removed using the forceps access so removed with access. So in normally what the physician will do whenever the patient present with the foreign body embedded in subcu level, you need to confirm location and depth code, the CPT, and also imaging if needed or not. You need to check that. So how you will assess complexity level? In simple foreign body removal, minimal dissection. Okay. No deep tissue exploration is done. Okay. It then in that case you will call 10120. Whereas in complicated, you will check for dissection of underlying tissues. Okay, whenever he's doing dissection of underlying tissues, in that case you will code complicated. So your CPT will be 10121. Okay, next wound management, sutures or secondary healing, in that case you can code 10121 as a complicated. Next we have 10140. So 10140, here the diagnosis will be hematoma, seroma or fluid pocket. Okay, here the patient with the swelling or fluid collection. Okay, so same incision is made and hemostat used to penetrate the fluid pocket. Fluid, he will evacuate the blood or a serous fluid. Okay, optional things what he will do, latex drain or a gauze packing, he will do it and apply pressure dressing, drain, packing, remove within 48 hours and wound management. Okay, primary closure and leave open to granulate. Okay, the procedure is completed. Okay, nothing much. He will evacuate the hematoma, seroma or a fluid pocket. In that case, you will code 10140. That you need to remember. This is this CPT is for hematoma, seroma, fluid pocket drainage. Okay, simply he will evacuate, fluid evacuated. Okay. Next, we have 10160 is for abscess, hematoma, bulla or cyst. So 10160, he will use large bore needle is attached to the syringe. So he will insert the needle and he will aspirate the fluid. Okay. So fluid space decompressed, needle is removed, apply pressure, dressing, procedure complicated. So this is the thing for the 10160. Hope you understand. Thank you. Subscribe for the latest surgery videos for SDC training, and you can contact me at sdcmedicalcoding@gmail.com. See you in the next part of the integrated system CPT coding. Happy coding.